So I'm going to be discussing the vantage points of why the flu vaccination should be mandated for patients and parents as their stakeholders. So in 2018, it was found that around 41% of adults did not intend to get the flu vaccination, which is huge because that's almost half of the citizens in the United States. In addition, every year we usually see about 3 to 5 million severe cases of influenza with about 300,000 to 500,000 deaths. It has been in addition, it's also been found that those who get the flu shot will have less severe symptoms than those who did not get the flu shot and still got the illness, because it is possible to also get the flu while already getting your flu shot. The flu vaccine reduces your risk of getting the flu by 40 to 60%, but it really depends on the year because it's changing a lot. And it's very important for pregnant women because it helps reduce getting the risk of getting the flu, as well as like other respiratory infections and other complications that come with the flu. And it reduces their risk of hospitalization due to up to 40%, which is big because a lot of women are already paying for prenatal vitamins and other stuff for their child. In 2015, it was shown that the flu vaccination among adults reduces the risk of being admitted to an ICU unit by up to 82%. In addition, it also helps with those who have chronic conditions and that are working age and older adults. It also has been shown that there are lower rates of cardiac events if people, due to the flu, with those with heart disease, especially if they've already had a cardiac event within the past year. And then also the flu vaccination has been shown in separate studies to be associated with reduced hospitalizations among those with heart disease and chronic lung disease, as well as other pre-existing chronic conditions. So in addition to patients as stakeholders, which I just discussed, parents are also huge stakeholders when it comes, because they decide if their children will be receiving the vaccine. So a big thing with parents not wanting their children to get the vaccine are people that are more anti-vax for many reasons, just like because a lot of people think health, or they grew up anti-vax, so they can't stay the same way with their children. And a lot of people still believe the false claim that vaccines cause autism, so they don't want their children to receive the vaccines, which is important for the health of their children. It also has been shown that the flu vaccine can significantly reduce a child's risk of dying from influenza. It is very important within babies under 6 months and just children in general, as they have weaker immune systems than normal adults do. It's especially important in children who have asthma, lung disease, heart problems, or chronic conditions, weakened immune systems, and more, because it helps decrease the chance of serious complications or even death of the child. And influenza causes serious complications such as pneumonia, dehydration, brain dysfunctioning, sinus infections, and ear infections, which are also help reduce the cost of childcare, or like even having to stay off work to take care of your child. So if the flu vaccine was mandated, we would be able to reduce hospital costs, other medical care costs, reduce deaths due to the flu and flu-related complications, as well as the cases of the flu each year. So I've discussed the vantage points of why it should be mandated for parents and as well as children. Thank you.